Secretary Kennedy, how are you? You know, in public life, we all make misstatements, all right? A couple of hours ago, I think you said to Senator Wyden that we now pay the lowest prices in the world for prescription drugs. That is an absurd statement. Nobody in the world believes that. Do you want to correct that statement?
It's for the drugs that are on Trump RX.
I'm not talking about drugs. You said we pay the lowest prices in the world for prescription drugs.
Those drugs we do.
I'm sorry?
For those drugs we do, Senator.
Well, for certain drugs. But in general, would you agree with the RAND Corporation and every other independent survey that we continue to pay the highest prices in the world? In many, you agree with that?
Many drugs are not covered by the agreements yet.
On average, do we pay the highest prices in the world?
As we always have, except for the most common
I'm not saying this is a new development, but you said a moment ago that we pay the lowest prices in the world.
The most common drugs we do, or GLPs, or IVF drugs, or COPD drugs, or asthma drugs, for insulin.
Well, let me give you an example. For the cancer drug Opdivo, it costs $260,000 in the United States, costs $56,000 in Japan. We pay on the lowest prices, et cetera, et cetera. Senator Welch made the same point. All right, the bottom line is, look, there are thousands of drugs out there. There may be a drug here or a drug there. We pay lower prices. In general, according to the RAND Corporation, we now pay nearly 3 times as much for prescription drugs than 33 other countries in the OECD. You agree with that?
For the most common drugs, we have the lowest prices.
All right. I am working on legislation which is not inconsistent with what Trump has talked about, and that is we should not be paying higher prices for prescription drugs than people in Europe or in Canada. Is that a concept that you can support?
Yes, President Trump wants this codified, and you have a lot more power than we do.
You're right. You're exactly right, and that is why I am going to be offering an amendment to the budget process right now, which would in fact codify what Trump is talking about, that the United States should not be paying higher prices than other countries around the world. Is that an amendment that you can support and get Republicans to come on board?
We will work with you, but in theory, that's exactly what we want.
All right, let me ask you another question. We're on the Help Committee. Casey Means, who is the Trump nominee for Surgeon General, was before us a while back. She agreed with me that TV ads, prescription drug TV ads in America should be banned. As you may know, we're one of 2 countries in the world. Do you agree with that?
Yes, I agree with it in theory. Constitutionally, you can't ban it, but we are now regulating it for the first time, and you'll see that the ads have changed on TV recently because we've sent out 1,000 disciplinary letters.
You may be right, but I think, you know, the people who determine the constitutionality of laws are the Supreme Court.
Well, we worked a lot on it because I wanted to regulate it.
Okay, but bottom line is, am I hearing you correctly to say that you would like to see a ban on prescription drug TV ads?
Yes.
Okay, good. There are a lot of seniors in this country who right now cannot afford dental care. Many seniors have no teeth in their mouths, can't afford hearing aids. I am introducing an amendment to the budget process which would expand Medicare to cover dental, hearing, and vision. Is that something you can support?
I'm happy to talk to you about it. I'm happy to work with you on it.
Other question. Right now, we have a diabetes epidemic in this country, an obesity epidemic. Many parents who would like to buy healthy food for their kids really can't make sense of the labeling on food products. All right? Other countries in the world are quite clear in their labeling about the amount of sugar, et cetera, that's in a product. Are you guys making any progress in coming up with simple, strong labeling on food products?
Yes, we are.
When will we see something?
Well, the delay in it has been that one of the big enemies, as you point out, obesity is costing 80% of Medicaid and Medicare dollars. One of the big problems is ultra-processed food, and there has been no federal definition or any useful definition. We've now worked out a definition. There are other, and here at HHS, we're in the process of going through the interagency process. There's other agencies that are Equity, USDA, Department of Commerce, OMB, and they are reviewing our regulations. As soon as we promulgate those, we already have the labeling ready to go.
Do you have any sense when that will be?
Excuse me?
Any sense when that you'll be promulgating that?
It has to go, Senator, through the other agencies that I don't have any control, but we want it to happen quickly.
Yeah, thank you.
Mr. Chairman, before he leaves, let me agree with Senator Sanders and ask unanimous consent that an article in the New York Times which shows that there's a higher price for Wegovy on Trump RX. This is the fact in terms of America, and Senator Sanders has been correct.
Without objection. Senator Warnock.
Thank you, Brother Chair. Secretary Kennedy, you're here today to defend the President's budget request. In September, you said that the CDC, quote, will again become the world authority on infectious disease policy. Do you still stand by that statement, yes or no?
We already are.
Secretary Kennedy, do you know what rabies is?
Rabies?
Yeah, do you know what it is?
is?
Okay, so
Yeah.
rabies, people contract rabies, as we know, through bites from infected animals like skunks, foxes, like raccoons,
Yeah.
and it can devastate a family. When a pet is infected, it is very serious. It's 100% fatal in humans.
Yes.
If left untreated, and generally it's a horrific experience. Staff at the CDC Rabies Division in Atlanta, Georgia, have historically been able to field emergency calls 24/7 from providers about complex rabies cases using CDC expertise to determine appropriate care. Secretary Kennedy, since you and President Trump took office, do you know how many people are left to staff this 24/7 line?
I do not know, Senator.
Okay, so the answer is one. So I want you to know that there's one person left to staff a 24/7 line to respond to rabies, a disease which left untreated.
You know how many
is fatal.
rabies cases there are every year in the United States?
So I'm asking the questions. The CDC's infectious disease work has been so decimated under your leadership that there's only one person left to staff the line and respond to families about this very deadly and terrifying infectious disease. Let me ask about another disease. Secretary Kennedy, do you know what prion diseases are?
Yes, I do.
No? Okay, thanks. And when you think of prion diseases, one of them would be mad cow disease.
Mad cow disease.
And diseases like mad cow disease can be transmitted from animal meat to humans, and it can cause a rapid onset of dementia, challenges with walking, personality changes, and severe insomnia. It's also 100% fatal, and there is no cure, with people's brain tissue essentially turning into a sponge before death. Do you know which office at CDC monitors prion disease? So
I do not know, Senator.
it's the Prion and Public Health Office. Do you know what population is most at risk of contracting the disease?
I would say it's people who eat meat from CAFOs.
Yeah, so hunters. Prion and Public Health Office is critical in a state like Georgia. In Georgia, we have a lot of hunters. There are more than 600,000 hunters in my state, but your budget proposes to eliminate this office. Respectfully, you seem distracted, Brother Secretary. Why does your budget proposed to eliminate the CDC office that focuses on monitoring this deadly infectious disease that's especially a risk to rural communities. Why are you proposing to eliminate the office?
You know, there's a lot of cuts at the agency that nobody wants. We have a $39 trillion debt. We've been asked to cut across the agency 12%.
I assure you that the 600,000 hunters in Georgia would want this office. They would want the protection. I assure you that families that are dealing with rabies or the prospects of that would want to know that somebody's going to answer the phone when they call. You've come to Congress and justified destroying the CDC